Ladies and gentlemen, welcome to today's presentation. It is my pleasure to introduce to you Jennifer Johnson, the Director of Faith-Based and Community Programs for the American Red Cross Los Angeles region.
Thank you, John, and the whole communications team for making this webinar possible. And thank you, community and faith leaders, for joining us for our first community conversation, Experience of Asian Americans under COVID-19. My name is Jennifer Johnson, and I have the privilege to serve as the Director of Faith-Based and Community Programs for the American Red Cross Los Angeles region. Most importantly, I hold the intention that you and your loved ones are in good health and in good spirits. In honor of Asian American Heritage Month, your faith and community team at the Red Cross wanted to give you the opportunity to gain insight into the unique challenges facing Asian Americans during COVID-19. Our intention is to give you, as leaders in the community, access to area experts who can shed light on the tremendous burden that our Asian American community is carrying during this pandemic. Our intention is that you will take this information and these resources back to your membership and your communities, because when we know better, we do better. We will do our best to not lump all Asian Americans into one group, and we ask your patience as we navigate this difficult conversation. We are trying to cram a lot of information into a little bit of time because we know your time is valuable. Our mission at the American Red Cross is to prevent and alleviate human suffering in the face of emergencies. You've probably heard the term holding space. Holding space is the process of witnessing and validating someone else's struggle while also being present to your own challenges. Think of it this way. When you hold space, you are creating a container for the other person's experience. We are thankful that you are here with us today to hold space for the unique experience of Asian Americans in this difficult time. Before I introduce you to our experts, I wanted to share the flow of this webinar. First, you will hear a bit from each of our panelists. Please watch the chat box as we will be dropping resources in there for you. After everyone has presented, we want to hear from you. So please use the chat box for your questions. And of course, if our speakers have a question for another panelist, ask away. This community conversation is for all of you. I want to thank and welcome our speakers. I want to thank and welcome all of our guests who took the time to attend today. I'll introduce all of our speakers, and then the speakers will go in that order. We'll have a time to ask questions, and then we have a little special ending so we can go away feeling hopefully a little bit better. First, we have Jackie Dye, Supervising Attorney from Neighborhood Legal Services, Los Angeles. Manju Kulkarni, Executive Director, Asian Pacific Policy and Planning Council. Robert Sawell, Assistant Executive Director, LA County Commission on Human Relations. Dr. Sheila Wu, Director and Licensed Psychologist, Asian Pacific Counseling and Treatment Centers, and our very own Barbara Caldwell, the Red Cross Disaster Mental Health Lead. So Jackie, if you could go ahead and start, we're ready. Thank you.
Hi, thank you so much, Jennifer, and the entire Red Cross team for inviting me today to share about the Asian American experience during COVID-19. As Jennifer mentioned, I'm a supervising attorney with Neighborhood Legal Services of Los Angeles County, which is one of the largest and most prominent law firms, nonprofit law firms throughout California. We were founded in 1965 as part of the War on Poverty under the Lyndon B. Johnson administration. I supervise the health law unit at Neighborhood Legal Services of LA County. And what that is, the Health Consumer Center is a helpline operated legal service, free legal service, where all residents of LA County can contact us with any questions that they might have related to health insurance coverage, access to healthcare, or any medical debt type of questions that they might encounter through their access to healthcare or medical care. My background is in disability law. I have dedicated and committed my entire legal career to working with people with different types of disabilities, including intellectual and developmental disabilities. And I've served in different positions throughout that time. I've worked as an advocate in disability law, an attorney, and mediator, as well as an administrative law judge with the State of California Special Education Division. The areas of law that Neighborhood Legal Services of LA County covers include housing law, immigration, family, healthcare, and also we have a unique unit, which is the disaster project within Neighborhood Legal Services. And that's how I was invited to come here today to share information with the faith leaders and also the community. In order to access our services, as I mentioned, there's 3 primary ways. There's a helpline where currently all of NLSLA is working remotely, and you can access us through a general helpline. It's 1-800-433-6251. The health consumer helpline is 1-800-896-3202. You can also access our services online now through an online legal services application. I can also share the link with the group at the end of the presentation, or via email for the Health Consumer Center. We can be reached via email Monday through Friday, 9 to 5 at hccreferral@nlsla.org. So some of the things that we've been seeing at NLSLA on the grounds include family law. People have contacted us with questions related to domestic violence or filing domestic violence restraining orders, loss of employment or reduction in employment, and finding out more about which public benefits programs they might be eligible for, whether it's unemployment benefits, eligibility for Medi-Cal services, and or eligibility for the state healthcare exchange marketplace called Cover California. So we've been fielding a lot of those calls in different various areas. With regards to housing, primary area that we've received a lot of calls on are eviction, because there's been an eviction moratorium in LA County. So a lot of the things that people commonly see after a disaster, which is a rise in domestic violence cases, a question about what am I going to do in terms of loss of employment, food, and shelter. So those are the main areas, topic areas that we're seeing right now on the ground. Our work has changed quite tremendously. And I really have to give thanks to our technology team at Neighborhood Legal Services of LA County. We had a pretty seamless transition to remote process due to the advanced technology that Neighborhood Legal Services of LA County was able to access during the period of time. We encountered similar problems as other people have faced at other agencies in terms of laptop shortages, internet connection issues, but we've had a pretty seamless transition the last 2 months or so. In response to widening and broadening the access to people in LA County, we also recently launched an online intake or request for assistance process through our website. So if you go to our Neighborhood Legal Services website, you'll be able to access those as well. In particular today, Jennifer had asked us to speak on what unique challenges Asian Americans are facing during COVID-19 and the pandemic. Some of the unique challenges include immigration status or fear of public charge. There has been worry in the Asian American community that applying for Medi-Cal or accessing county healthcare services may impact their immigration status. There's a resource that we've shared with Jennifer and the Red Cross team where you can access an online, fill in the data for whether or not applying for a particular public benefit will impact your public charge. Another area where Asian Americans have encountered some barriers to accessing various public benefits during this time is in terms of their limited English proficiency. So if English isn't their first language, all of the hurdles that they would encounter include whether or not the materials are translated in their native Asian language, whether or not there's interpretation capabilities or capacity on for those public benefits that are available through the phone system. And so that's a unique challenge that Asian Americans face during the pandemic, because it's an additional barrier to accessing public benefits and other related services, especially right now when most of the agencies that they typically rely upon have transitioned from physical locations to remote work, like many of the businesses, other businesses, including NLSLA. On a more personal note, something that has posed a unique challenge for Asian Americans is the loss of employment and reduction in work hours or business closures altogether related to COVID-19. Asian Americans had been more of a larger population in terms of opening small businesses or pursuing an MBA, for example. And on a personal note, I've had numerous friends or family members that have come to me to ask for assistance with where do they apply for unemployment benefits related to COVID-19, and also what health insurance benefits they might be eligible for during this time. And it's not something that they may have thought about previously, because many of the people were middle class or even upper middle class, but because of the sectors that they happen to work in, whether it's the retail sector, hospitality, or if they own their own small business and they're waiting for approval of their PPP loan, it's caused an enormous amount of stress upon both the individual, and also their family members. So thank you.
Thanks, Jackie. I appreciate you talking about that. And then maybe at the end, I'd love to hear some examples of what is and is not public charge, because I know that that's that can be confusing. I just wanted to let you know Manju Kilkearney is running a little bit late. So Robert, could you go ahead and start, and we'll kind of flip it. We'll talk about what the county is doing, and then Manju will join us to talk about what the data shows.
All right, good afternoon. LA County's Commission on Human Relations, where I'm a part of the staff, was established to continue work begun by a County Board of Supervisors Committee created in January of 1944 in response to attacks by mostly white young men in the military on local young men of color in the downtown streets of Los Angeles. And our continuing mission since that time has been to bring people together across boundaries of difference, to transform prejudice into acceptance, inequity into justice, and hostility into peace. And so throughout our agency's history, among the many things that we do, our work has included documenting, preventing, and responding to bias-motivated hostility, acts of hate, and discrimination. So since the outbreak of COVID-19, we've been focusing on the ongoing rise in hate acts, both crimes and incidents. And when I refer to a hate incident, I'm talking about a display of bias-motivated hostility that doesn't include criminal actions. As the uncertainty and restrictions continue, there's growing tension, frustration, fear, and we know from far too many experiences in the past that that kind of fear often degenerates into negative assumptions and stereotyping expressed in acts of prejudice, discrimination, and hate. So far, initial reports include more than 100 COVID-19 related hate acts, both crimes and incidents, in LA County from February through April. These reports come from calls to 211, and I'll tell you more about that in just a moment, reports to the Stop Asian American Pacific Islander Hate website, which I believe Manju Kulkarni will speak to in just a moment, and reports from police departments. And well over 90% of these reports have targeted persons of Asian descent. These reports range from derogatory verbal insults to threats of violence to physical assault. And they appear to be happening all over the county. And most of those reporting that they are being targeted are women. We know from past surveys and from conversations with people who are targeted with hate that many people who are targeted don't feel comfortable or safe reporting what they're experiencing. So that means that even though these numbers are high, the actual numbers of hate acts probably are much higher because of the fact that people often don't feel comfortable or safe reporting. Now, our agency is working to stop the spread of hate as we all work together to stop the spread of the virus. Supported by action from the County Board of Supervisors, we've launched a three-part strategy that I want to briefly describe to you. First, we're encouraging people to report acts of hate. If we know what's happening, where it's happening, and who's involved, we can take action to respond to serve those who are targeted and prevent the spread. And when I talk about reporting acts of hate, I'm talking about actions that you may think are illegal, that are criminal, but even actions that you don't know are criminal, they're just hostile and aggressive acts of bias. And our partner in reporting is 211. So people can call 211 or go to the 211la.org website, and either way report an experience of hate. 211 is ready to respond 24 hours a day, 7 days a week in multiple languages, in many languages. It's a safe place to report. And when people report to 211, they can get support and help. The second part of the strategy I want to describe to you is that we're sponsoring a growing network of partners to assist people targeted for hate. Our partner for this part of the strategy is an organization called Special Services for Groups. And assistance is available through the network, including legal assistance to defend civil and human rights against hate and discrimination, support from trusted community and faith-based organizations, counseling and healing for those traumatized by hate and hostility, and assistance with reporting hate crimes to law enforcement, including helping to be sure that law enforcement intervenes in a timely way. And then the third part of this strategy that I want to tell you about is that we're calling for the diverse communities of LA County to unite. We're calling the people of LA County to stand together against scapegoating and hate, targeting people based on prejudice and stereotypes. This is not a new thing. It's not that COVID-19 has created prejudice. It's been with us as far back as anyone can remember. But it seems that in the current atmosphere, fueled by the fear and uncertainty in the health emergency, people are feeling that it's more and more acceptable for them to express openly and visibly their bias and their prejudice. And we have not done what we need to do to stand together to say, that's not okay. That's not acceptable as normal behavior in our communities. And so that's how you can be part of the solution. First, please spread the word about 211 as a place to report hate. If people are being targeted for hate, they can report. If you witness someone being targeted for hate, you can report, and there will be people who are available to assist. Be sure that your family, your friends, your communities are ready to be upstanders, not bystanders. When they see or hear hate or prejudice, whether it's disguised as a joke or actually an openly hostile attack, get them ready so they won't just stand by passively and watch. And make sure that they remember that we don't fight hate with hate. So we're not going to respond to acts of hate by attacking, but we do want to step up. You need to stay safe, and if necessary, you want to get help, but don't just be silent. People who are aggressors and actually perpetrating these kinds of acts often interpret silence as support. And so we don't want to do that. That just feeds the spread of hate, and we want to come against that. It's a sad thing to see that people who don't find it acceptable to spread a virus are entirely comfortable with spreading the pernicious poison of prejudice. But it's a marvelous thing to see that people want to make a difference. We know that the vast majority don't support hate and discrimination. And so it's time for that vast majority, us, it's time for us to speak up and speak out. You can help lead the way. Leadership is the stewardship of influence. And so community leaders, faith leaders, use your influence to call your people to speak up and speak out for all of us to come together. We're in this together. We'll get through it together. And the remedy for hate is compassion and community. So share the love and we can stop the hate. I'll be happy to give more details in response to questions as we go further, Jennifer. Thank you.
Thank you so much, Robert. And I'd love for Manju to start now, please. Thank you.
Hi, Jennifer. Okay, okay, great. Hi, everyone. My name is Manju Kulkarni, and I am Executive Director of AppCon. We are a coalition of more than 40 community-based organizations that serve and represent the 1.5 million Asian Americans and Pacific Islanders in Los Angeles County. I'm going to start by sharing my screen so that you can see my slides. Hopefully that works. There we go. So a little bit about AppCon. We were formed in 1976 as a coalition of executive directors who really wanted to find policy solutions for some of what they were saying in their local communities. And so they began to work together, forming AppCon and looking at ways to address issues around housing and homelessness, environmental justice issues, workplace development, as well as hate crimes, and also issues around human trafficking and healthcare access. We've also been involved in bridging communities of color together in that time, serving as a conduit for a dialogue between African American and Korean communities after the uprising that took place in the 1990s. And finally, now we serve as the lead for the 2020 census for Asian American Pacific Islander communities. You can see there the 20+ organizations that are part of our collaborative, as well as the languages in which we can provide services specifically on the census. So in terms of what has changed about our work over the past few months, what has changed is we have seen a significant emergence of hate incidents against Asian Americans and Pacific Islanders in the United States. So I wanted to share with you 3 different incidents which are really emblematic of what's taking place across the country. So on the left, you see a story of grandparents who experienced racial racial epithets when they were taking their grandchild on a walk. In the middle, an adult who experienced refusal of service by a ride-hailing company as they were trying to get a ride from the airport. And then finally on the right, the incident that took place here in Los Angeles before there was a single confirmed case of COVID-19 in Southern California. And this was where a middle school child was physically attacked and verbally assaulted because he's Asian American. He was accused of having the coronavirus and told to go back to China. And when he responded that he was not Chinese American, he was beaten in the head 20 times. So these are obviously all concerning. And unfortunately, these track with a few recent polls. An Ipsos poll from a few weeks ago found that 30% of all Americans had witnessed someone blaming Asian Americans for COVID-19, and 60% of Asian Americans had experienced the same. Similarly, the Harris poll, which came out this week, found that 75% of Asian Americans are concerned right now about facing hate and discrimination against themselves and their family members. So after we began to see this, not only in Los Angeles, but across the country, we formed a collaborative with Chinese for Affirmative Action and San Francisco State University, and we launched StopAPIHate on March 19th. We also made sure that the forum was available not only in English, but also in 11 Asian languages, and conducted significant amount of outreach to limited English proficient communities, to immigrant communities. And because the three collaborative partners have over 150 years of experience combined working in Asian American communities, we began to see very quickly the number of incident reports rise and be reported to us in ways that they unfortunately have not been reported to government agencies. Those reports, in terms of what our data gathering is, are provided on the AppCon website. And in 6 weeks, we have received over 1,700 incident reports from 45 states and the District of Columbia. This is what the forum looks like. So you can see it, or rather the web page of the forums. So you can see all of the languages. And then there is also links to the reports of our data and analysis, as well as the press releases. In terms of what's happened here in Los Angeles County, in that first month, since we launched the website, we have seen almost 100 incidents. The vast majority of these are hate incidents and not hate crimes. I want to be very clear about that. These are most often involve verbal assaults against individuals, verbal harassment. 6% involve civil rights violations. About 7% are physical assaults, and 74%, as I said, involve verbal comments. What's also interesting is the fact that 2/3 of the respondents here in Los Angeles County are women. So we are seeing a disproportionate impact on women in our communities. And what's also troubling is the fact that 50% of these incidents are taking place at local businesses. So what that tells us is that despite shelter in place, individuals are being harassed and assaulted in their grocery stores, in their pharmacies, in big box retail, and even in their neighborhoods. So the few places that we're allowed to go these days are places that are unfortunately sources of harassment, shunning, and even physical assaults. So we have a four-pronged approach to our work, which is to serve as a reporting center to give individuals an opportunity to share their stories, and also for us to collect data and provide analysis on trends and patterns. We also seek to provide resources to community members, as well as assistance in terms of helping people know what their rights are, and potentially getting access to mental health services, and also to legal information. And then finally, the last prong is advocacy, which we have been conducting at local, state, and national levels. So in terms of moving forward, we ask that folks share widely our website. I've listed it here, but you can also just Google StopAPIHate, and it'll take you directly to our site. We also want to make sure that we're providing reporting to government agencies. We're participating in state and local collaboratives to work to prevent these incidents from happening again and help address those that are taking place right now. And also we want to work with local businesses to ensure that there's proper training so that they know that their employees cannot be engaging in hate incidents or any type of discrimination or refusal of service, as well as working with our Asian American business owners who they themselves have been experiencing vandalism on top of loss of business as a result of COVID-19. So with that, I just want to thank you for the opportunity to share a little bit about our work. I'm happy to answer any questions at the end. And again, appreciate the opportunity to be with you today and to join with the esteemed panelists. Thank you. I'll unshare my screen.
And Dr. Wu, if you could take it from here.
Hello. First of all, thank you for inviting me to join this community communication on the experience of Asian Americans during COVID-19. I am with the Asian Pacific Counseling and Treatment Centers. We have 5 different locations in LA County and 2 in Riverside. And as Robert actually mentioned earlier about special service or groups, Aap CTC is one of the divisions of SSG. So we have actually worked with 211 very closely on some of the referrals that you mentioned. Our main mission is to serve the low-income, underserved immigrants of API. All of our staff are bilingual. We probably have, I don't know, maybe 13 to 15 different languages and dialects at our sites. Our mission really is to provide mental health wellness, advocacy, recovery work with the people that we serve. COVID-19, when it started, we were in some ways kind of in a panic mode ourselves as well, because we're not able to see our clients in person. And so we had to quickly translate all of our work into whether telephone, telehealth, text, email, etc. So there was a period of time where we had to kind of set up a new operation, if you will, for our modality of service. And so we had to get telehealth software, have new protocols on how we're going to open new cases. And the challenge also is to help these clients to set up software in their phones or in their homes, etc. We've also had to become really creative. I know Jennifer had asked me and say, well, what do you do with clients who don't have internet at home? And really, we've had to help set up some session rooms on site where the clients can come into our office. They use the session room that we have a computer or a phone or an iPad. And our clinicians, our psychiatrists, our therapists are actually in the next room in our office space. Some clients do prefer to do that because they either don't have access to internet or the technology, or they actually don't have a safe private space at home that they can do their therapy in. As far as another change, obviously, is to make services available to school-based kids. And as you know, schools have been closed. And so it was very difficult to kind of set up services for these students. We're competing with the school with their e-learning, and some students and families and parents are saying there's just too much Zoom and they're actually really burnt out. And so, you know, we've had to really become creative to have to be really fluid with our service delivery. For our seniors and our clients who are in board and care, we've had to provide different kind of hygiene and PPEs, and we drop off like care packages for them as well as at their residence. Some of the challenges that we're seeing really continues. It hasn't changed in all these years, but there's still a lot of stigma in seeking mental health services. And as Jackie mentioned earlier about the public charge, many of our clients, they're even more fearful now to access services because they don't know what's going to happen. In addition to what Robert referred to with the anti-Asian hate sentiment, they're even more scared and they want to stay home. So we've had to really provide a lot of reassurance, lots of education for our clients and their families. In addition to that, we work with many of the refugee population, and because of the COVID, actually a lot of their past trauma from the war experience resurfaced, and a lot of the traumatic experiences, the anxiety, and that's where they are really seeking for stability and security. Some of them find it in, buying 5 bags of rice just so that they feel like they have food. And this is all triggering from their past trauma in their war. As you know, many of the API also are entrepreneurs, noodle shops, boba shops, grocery stores, laundromat. They're losing their businesses, so lots of unemployment that we're seeing. Many of these are immigrant families, first generation. They do not speak good English. Many of them are also monolingual. They don't know how to access services. So it's great to have resources like Jackie's, where there are also information and resources in their own languages. In terms of kind of a family tension, there's been a lot more of parent-child conflicts, lots more domestic violence reporting, just because people are at home. And when you're at home, you're cooped up, it just creates a lot more tension. And so we've had to do a lot of interventions in that arena as well. One of the things that we're seeing more lately are families who have COVID-related diagnosis or death. And some of our families are, because due to social distancing, they are not allowed to go into the hospitals. So they can't say goodbye to their loved ones who have been diagnosed. They're dealing with loss and grief issues and having to manage setting up funeral services, etc. And many of the families are saying that we can't be in the hospital bed with our families, and we're really relying on the nurses and the doctors to be holding their hands. And it's just really sad to see that they don't have a chance to say goodbye. And so we're dealing with a lot of loss and grief issues in the community as well. And at our organization, we found that it's actually the very first time that we had to fundraise for these emergency funds for these families so that they have some resources to help them with the funeral services and additional cost. So I guess what we can offer you at our center is, as we all know, May is Mental Health Awareness Month, as well as API Heritage Month. So we've come up with a lot of different workshops. There are mental health wellness workshops. We're doing a lot of Zoom workshops on stress management. We're doing yoga, art classes with the students, Tai Chi, different types of support groups, etc. And so we have a lot of activities in all of our different locations. So if you're interested or if you want to make a referral, feel free to check out our website and or our Facebook page. We usually post our graphics and flyers for events in our Facebook and our website as well. We are open for referrals, any mental health related assessment or counseling for individuals, family, child, adult, older adult. You know, just give us a call and make the referrals, and we will do our best to try to link them to services or provide whatever services that the families would need. There's also a website that's really great. It's Each Mind Matters. And there's a lot of resources on mental health services and support, etc. So that's all I have for you. Thank you again for this opportunity to share our services and the resources for the community. Thank you. Back to Jennifer.
Thank you, Dr. Wu. And I'm interested in looking at Each Mind Matters too. So thank you for sharing that resource. And we have our last speaker is our very own Barbara Caldwell, who is our disaster mental health lead. Go ahead, Barbara.
Thanks, Jennifer, and thank you to the panelists. I actually learned a very lot today, and I will be taking it back to my folks. I'm a volunteer with the American Red Cross. I have been, this is my 25th year, and I have a number of mental health professionals across all licenses, social workers and psychologists, marriage and family therapists. Normally what we do when they're not in private practice or teaching, they really are volunteering their time to make phone calls to people after our single and multifamily fires. We also are teaching classes to our volunteers, to our staff, also out in the community to different organizations. But most importantly, I think we do a lot of practice exercises with our LA and county partners, especially with LAX, in helping the airlines understand about the different parts that Red Cross will play in an aviation disaster. So those are some of the things during the regular day that we do as we volunteer our time. As you all know, as part of disaster services, we are actually responding to disasters here locally. We've had a number of wildfires over the last couple of years. We've had mudslides because of the rain and the wildfires. We're usually providing emotional support, looking at going out after the shelters are beginning to close, talking with people in the community who have been affected, even though they may not have been in the shelter, because a number of folks have been affected. And then we also do some home visits, especially if we have had any fatalities. And we did all of that prior to face-to-face, prior to COVID. And now with COVID, we have a whole new set of protocols, but it's not changing what we do. It's just how we do it. And for disaster mental health, we will be doing things virtually. And we, as everyone had mentioned, it's been difficult. We're used to standing in front of a group of people, seeing how people react, knowing what we need to say or do. And now we need to do this virtually. And so we had to learn new platforms. Many of my clinicians are trying to stand up their private practices and so forth to help the community, to help their clients. And what they're doing now at this point is really listening to what's happening out there, and they're beginning to do some support groups and individual meeting with individual clients via some kind of virtual platform. The work for us started back probably about 10 weeks ago. It's hard to remember. It seems that the days all kind of meld together, even the weekends. But we received information and protocol from our national headquarters. And then we also are really staying informed with the Centers for Disease Control. They're the ones that have the information that we feel is the most pertinent, and we want to be sure people have the right information and are not getting confused with everything that people are saying. And so today it really is looking at where we started with anxiety and stress, what that meant for all of us, then going into being safe at home, being confined. That anxiety, that stress is still there. And so for many of us, we're really looking at how to help folks find and alleviate some of that anxiety and stress, helping them with how to cope. Lately, and through some of the presentations today, you've heard how much that anger has turned into disrespect for people, turned into violence towards one another, even within our families. And so at this point, it's really just trying to help people learn how to cope, what we need to do to help them to take the virus seriously. It is affecting all of us and being overwhelmed. But one of the things that I heard today, and this is where we are kind of moving toward, is because of all of the deaths that we've had across this nation. And so our national headquarters is beginning a program. It's called an Integrated Condolence Care Program. And it's going to be coming out shortly. There will be a link and information that will be publicized throughout all types of media. And it really is focusing on families who have lost someone to COVID. And as you heard before, this is the struggle that all of us are having, not being able to be there when our loved one needs us or to be able to say goodbye. During this link, people will be able to request whatever it is that they may need. And we will have mental health professionals, spiritual care, and health services, nurses available to speak with families and offer some emotional support and to provide any resources that they may need. We're kind of small, if you can think about us as volunteers. So we don't have a lot of volunteers across the nation. And we know that with the hundreds and thousands of deaths that have occurred, this can be a kind of an overwhelming undertaking. And so we are actually working with our partners, professional partners across the nation. We are asking for their help to assist us. Because to man these, the call center, to work within our regions, within our cities and counties, we're going to need as many professionals as we can. And so in this time of kind of gathering everything together, we are developing a database for all of the resources. And here we've got some great resources today that we have within our cities, within our counties, and it's going to be a national database. So that if a professional from another state happens to be on the call working with someone here in Los Angeles, they will have resources here in Los Angeles for those families. But we're looking at trying to gather all of that information. The link, I believe, will be coming out within the next week, maybe week and a half. We are really pushing to get all of this done. We can also offer some of our psychological first aid trainings for staff and volunteers, our new professional partners. We're doing Coping in Today's World also within our communities. And I think the most important thing that will be of comfort, I think, from what we were just learning, is that we have our spiritual care partners who will be providing resources and information about virtual funeral and memorial services. And I know it's difficult not being able to be there, but I think we will be able to have those resources for some of our families. So we are really working together now across the entire our entire region here in Los Angeles, across the country, to get as many of those resources as we can loaded into that database so that we have the answers and the things that folks need as they begin to use this link that we will be coming out. There's a lot more I can probably say. I know I'm looking at time, and I want to be sure that, Jennifer, if there's any questions, I'm going to turn it back to you, because one of the things that I normally do is to provide some mental health tips, and I'd love to end that with it, but I'd like to go at least for questions for right now.
Thank you, Barbara, for sharing that. And thank you to all of our panelists. And I don't think that we have any of the questions. Jackie responded to what public charge is. It is in the chat box. I also wanted to say thank you to Kendall Dunlop Corsinus. She is my partner on Community Conversations, and she will be hosting one, I think in, what are we in July. I hope you'll join us for our next one in June. And the topic will be how we are grieving and worshiping differently under COVID-19. Thank you to the communications team, John, and to Jillian for being the behind the scenes and helping us all look good. And I wanted to thank Jackie, Robert, Manju, Dr. Wu, and Barbara, not just for speaking today, but for the work you are doing on our behalf. Our region is stronger because of you, and I am grateful. And we are here for you at the Red Cross. So if you'd like to reach out to us, our email is faith-based-LA, like Los Angeles. So faith-based-LA@redcross.org. Reach out to us. Let us hear from you, what you need, how we can support you. And I'll just say thank you to everybody for attending and for giving us this valuable time. Please take this information, talk about it on your Zoom calls and your Microsoft Teams calls with family and friends. We hope to see you next time. And then Barbara, will you take us out with some mental health tips to make us stronger, please? Thank you, guys.
Thanks, Jennifer. Yeah, I had a chance to kind of think about what I would end with, and I'm actually using some things as my mental health folks get together. This is one of the things we do, is we talk about how to take care of ourselves and how to help you take care of yourself, because we're here to help others. So I'd like for you to take away about 6 things. 1, be grateful every morning as you wake up for sight, for movement, for hearing. Be considerate of those that you live with and that you meet along the way. Wash your hands, wear your mask, smile with your eyes. If feelings of being overwhelmed or sadness sneak up, stop and take notice. Regroup. Maybe try a little breathing, stretching. Connect with family and friends by Zoom, Skype, FaceTime, whatever people need. Add exercise to your self-care. Walk, stroll around the block, take the dog out for a walk, stretch, but move. Get up, away from the computer, and move. For children, preteens, teenagers, they're going to need help with motivation. Help them find or create a routine. Their routine is different now. This pandemic has been a real big distraction for their normal routine. No interaction with friends, none of the social gatherings. It's difficult. Help them find that new routine. Remind yourself that it's the situation that is crazy. You are still who you are. It's the situation, not you. Together, we will get through this and grow in resilience. Stay well and healthy. Thank you.